I went in for my yearly exam. My doctor asked if I knew what my tuberculosis or TB status was. I had no idea what she was talking about. She explained to me that the Minnesota Department of Health is concerned about untreated tuberculosis in communities from places in the world where they are at a higher risk of exposure to TB. She knew that I had been born and raised in Thailand. She wanted to make sure that I was taking all the precautions for myself and my family. She asked if I wanted to know whether I had been infected with tuberculosis. I told her that I was not sick, so there was no need for a test. She assured me that my not feeling sick was a good thing, then explained to me that as many as 25% of the world's population have been infected with TB. But for many people, the disease is not active inside of them, so they don't experience any of the symptoms. She explained that it was possible for me to have been infected and not even know it. The danger with having the infection but not knowing it, and thus not treating it, is that it can develop into active TB, and that is much harder to treat. She said that the tests for TB were not painful, and knowing my TB status could only empower me. She assured me that both active and inactive TB are treatable, so I agreed. I was surprised when the doctor told me that I had tested positive for TB. After an examination and chest x-ray, she concluded that I had been infected with the bacteria, but it was not active within me. I had what was called latent tuberculosis infection, or LTBI. They found I was infected before I could have passed it on to my family or friends. I had no idea how I'd gotten the infection or when.
Tuberculosis infection is widespread. The disease is treatable with proper medication and continued care. When we talk about tuberculosis, we talk about two different stages: active tuberculosis and latent tuberculosis, or LTBI. A person diagnosed with active TB is often experiencing symptoms such as coughing, coughing up blood, chest pain or chest pain with breathing or coughing, unintentional weight loss, fatigue, fever, night sweats, and chills. People with symptoms are likely to be infectious. The disease spreads from person to person through the air when a person with active TB coughs or sneezes or sings, and people close to them breathe in TB. Once diagnosed, they must begin a proper course of treatment that may take anywhere from 6 to 24 months, depending on the particular nature of their infection. Without treatment, the person will continue to spread the disease to those closest to them. Without treatment, the disease can lead to death. On the other hand, a person diagnosed with latent tuberculosis will not be sick from the TB and will not spread the TB to others. In fact, most people will not have even known they have been infected. At this stage of the disease, they are not infectious. The danger is that people with LTBI may develop active TB if they do not receive treatment, particularly if their immune systems are compromised by illnesses, old age, chronic diseases such as diabetes, or other factors of health. It is important to treat people with LTBI before the disease progresses to active TB. The treatment protocol for LTBI is shorter and easier than for treating active TB. Testing for TB status is not a complicated process. Your medical team can administer the tests easily and quickly. There are two kinds of tests we use to detect TB bacteria in the body: the TB skin test and the TB blood test. Knowing your TB status is important to keeping you, your family, and your community healthy.
We here at Minnesota Department of Health are dedicated to working towards a world free of TB. We need your help to keep your community safe. We need you and your family to get tested for TB infection. Know your TB status. If you test positive for TB infection, You should have follow-up visits with your health provider for a chest x-ray to determine if you have latent TB or need other tests to check for active TB. No matter what your TB status, we want you to get the proper treatment from qualified professionals. There are different treatment options that you and your medical team can choose from. Don't wait to get sick before you look for help. Know your TB status. Protect yourself, your family, and your community.
I was scared when I first found out about my LTBI diagnosis, but with the help of a good healthcare team and a supportive family, I am getting treatment for LTBI. I feel good knowing that I have protected myself and my family from a deadly disease. Don't be afraid, get tested. Learn what your TB status is and do your part to make sure that you and those you love can lead healthy lives.
For more information, please visit health.state.mn.us/TB.